So my name's David Adam. I'm a GP in the eastern suburbs of Perth and also a hospice doctor with a community palliative care service. So I guess I'm in a slightly unusual position that I work for a primary, unreferred service and also for a referred secondary service. I think My Health Record benefits patients in a couple of ways. I think the first thing is that it frees them up from some of the burden that we currently place on them in terms of communicating between services and between doctors, in that we expect the patient to carry a lot of our handover. And so there are many things which are important to them, but which the details they don't necessarily remember, which is fair enough. It's often a complicated and deep area of information. And that can be as simple as the lass who came to see me on Thursday evening who needed a new asthma prescription, having transferred over from her usual GP. We didn't have the information in the notes, but we could get the information about the dosing from the My Health Record, so that saved her a trip back to see us and a round trip to her previous GP. For GPs, and I think for all doctors, I think the benefits of the My Health Record is that there's another additional source of information about our patients and about their treatment in the past. I think that pretending that it's going to be a magic one-stop shop where it will always hold all information, I think is probably unfair and is selling something that doesn't exist. But we can never have too much information in our jobs, and this is a really valuable secondary source to help us to look after the people in front of us and also to help them be looked after by other people. So to put an investment into their things like their shared health summaries will help their treatment in other services down the track. So we've been using My Health Record in our practice for a good couple of years. That's partly about uploading shared health summaries and also as a source of information. So downloading documents including medicines views, other practices' shared health summaries for patients transferring, for example, and in keeping track of how we've been going. I think for doctors and health services that aren't using My Health Record yet, I think it's really important that you at least take the first steps in finding out whether participating in the system is right for you, and that might be seeking out further information, attending training sessions, or visiting a practice that does use it and seeing how it can benefit your practice.